a woman appeared to me, who is an orthopedic surgeon. She's a reserved and quiet lady. She broke her leg and couldn't walk anymore. Furthermore, she was in a condition that even a colleague of mine, who always looked down on me, couldn't treat. I wondered if I could treat such a patient. I had my doubts, but she was the one who should be feeling anxious. I faced her conditions, and together, we tried to work things out with some treatment. Little did I know at that time, this encounter would change my life in a whole different way. My name is Terry Johnson. I'm a 30-year-old orthopedic surgeon. I work at a large hospital, so many patients come in through referrals. I'm busy every day, but I have a little problem. That problem is the presence of my colleague, Matt Adams. There's another orthopedic surgeon at my workplace, and that's Matt. He's an arrogant man who values educational backgrounds and often belittles me, who didn't graduate from a top-tier medical school, calling me incompetent. He even calls me incompetent like it's my nickname. In the US, there's a shortage of doctors, and there are many connections and factions among us. Perhaps it's understandable to be elitist because of this, but Matt is just too blatant. Sure, Matt is brilliant, and from his perspective, I might be close to being incompetent. But if you start saying that, then about half of the doctors in the hospital would be deemed incompetent. Matt and I run the orthopedics department of the hospital. This time, a slightly complicated patient is coming. Apparently, the daughter of some prominent figure or professor that Matt is close to is visiting our place today. It seems no doctor was specifically requested, but Matt seemed eager to take the case, saying, "She fractured her right thigh in an accident and can't walk. Well, if she's treated by someone as skilled as me, she'll recover quickly. They'll owe me one." Telling me the symptoms was probably just a minimum information sharing and a way to hint that I shouldn't interfere. From my point of view, I feel he should prioritize the patient's well-being. Matt is competent, so he should be fine. With that thought, I focused on examining my other patients. However, it seems Matt's treatment wasn't going as planned. Given that the patient is young, she should heal quickly, and it seems the bone I've heard Matt muttering this numerous times, and it's gotten me quite worried. Matt is arrogant and has a high pride, which has gotten him into trouble with patients on multiple occasions. He tends to clash especially with patients who are wary or don't go along with his prescribed treatments. While I'd expect Matt not to behave this way with a prominent figure's daughter, there's a real risk he could lash out at other patients. So, seeing Matt frustrated and confused, I hesitantly suggested, if it's psychological trauma, maybe it'd be better to refer her to a counselor. It could be the shock from the accident. "Shut up. Don't tell me what to do, you incompetent. I'm leagues above you," he snapped back, showing no intention to listen. It's not something that started just now, but I really do think he's incredibly stubborn. That stubbornness is necessary at times, but it seems to have gotten in the way this time. Turns out, a patient under Matt's care was transferred to me. Apparently, the patient's parents, seeing their daughter unable to walk for so long, requested another orthopedic surgeon to take a look if there was one available immediately. This seemed to have deeply wounded Matt's pride, and he was pretty livid, but at the end of the day, providing medical care is a service profession. The patient always comes first. It was here where I first met her, Amy. She's 21 years old. She got injured in a collision with a motorcycle on her way to school, and even a month and a half after the accident, though her wounds have healed, she still can't walk. Recently, She's been going through physical therapy with painkillers, but those medications can be hard on the body, and it's not ideal to take them for a long time. She had an X-ray taken with me again, but I couldn't find any issues that would prevent her from walking. So, I decided to listen to what she had to say. I'm not a counselor, so I can't fully understand a patient's feelings. But the one who knows a patient best is the patient themselves. Your leg hurts, doesn't it? Does it hurt now? Only when I try to walk, she said hesitantly, her gaze wandering. She seems really shy, and when someone like her encounters a dominant doctor like Matt, they might just go along with the treatment without voicing their concerns. She probably always agrees, without expressing her own opinion. Given Matt's nature, I suspect that after the initial diagnosis, he relied on data rather than the patient's voice to decide what treatment she needed. It's not inherently a wrong approach. Sometimes patients have misconceptions, and the real issue lies elsewhere. I mentioned earlier that the patient knows best, but we doctors need to identify any misconceptions or contradictions. Matt relied on data for his diagnosis, and it didn't work out. So, I'll make sure to include the patient's voice in my decision-making process. From our earlier conversation, she indicated that her leg doesn't hurt unless she's putting weight on it, suggesting that the pain might be due to the stress or strain. I decided to accompany her to physical therapy. I wanted to observe how she attempts to stand or move, from a doctor's perspective. Of course, detailed guidance would be given by the PD specialist, and I wouldn't interfere with that. Timidly, with a little help, Amy began to stand up. But she sat down immediately, saying, "My foot hurts." I mumbled. From the X-ray of her thigh bone, she looked perfectly healthy. This means the cause could be somewhere other than the thigh, or it might be a muscular or neural issue. But even if that's the case, there's weight applied when sitting, so there could be pain when trying to stand up. Should I check all possible causes meticulously? Lost in these thoughts, my gaze fell on her foot. That's when I noticed something. Her big toe was bent inward. Amy, I gotta ask, were you born with a bunion? A bunion is when the big toe deforms and bends inward. There are two types, congenital and the one caused by wearing narrow shoes. Amy had the former, the congenital type. And here, I realized our big misunderstanding. She said her foot hurt, but we mistakenly thought she meant her thigh. For us medical professionals, we know there is a distinction between foot and leg. But to the average person, it can all be referred to as the foot. And truth be told, Amy initially did complain about her thigh hurting. After all, it was broken. But we believed the only fracture was in the thigh, so we didn't take an X-ray of the foot. The drawback with X-rays is that you can't capture the whole body at once. You have to be specific about where you're looking. So we were focused on her thigh, not taking a foot X-ray. But when I took an X-ray of her foot, there was a small but definite fracture. Small as it was, it hadn't been properly set, and she had even started rehabilitation, so the bone still wasn't healed. One thing I want to clarify is diagnosing fractures can be really tough. Small ones can easily be overlooked. At first, it might seem like a bruise, but if the pain persists, another X-ray might reveal a fracture. It happens more often than you'd think. In Amy's case, the injury to her thigh was so severe that the small crack in her foot went unnoticed. There's also a minor fracture in the foot, and I suspect the pain might also be from bunions, so once the fracture heals, we should correct the bunion too. Understood. She nods. After that, she started her foot treatment, and the fracture treatment was successfully completed. While surgery is an option for bunions, they can improve significantly with the right kind of support and a change of shoes. So, there was a process of fitting her with a support brace. But for some reason, it seemed that Amy struggled to voice her opinions, trusting mostly just me. Usually, the adjustment of such braces is done by the nurses, but since she seemed more comfortable expressing her needs to me, I took charge. I was checking if she felt any discomfort with the brace on. "How about here? Is it too tight?" It's a bit loose. It's essential to wear the brace correctly, or its effectiveness diminishes." I was guiding her on how to wear it properly, but since it was her first time using a brace, there were some challenges. "What about this part? Should I tighten it a bit?" "No, stop." Suddenly she raised her voice. Though she generally spoke softly, so it wasn't very loud. It seemed I had tightened it too much. "I'm sorry, did I make it too tight? Would you like to try adjusting it yourself?" "I'll do it." Apparently, when I tried, it became too tight for her. In the end, she started adjusting it herself. Thankfully, this helped her get used to handling the brace, and she could put it on by herself. Thanks to the brace, the pain from her bunion eased, and little by little, she began to push herself more in her rehabilitation. It took some time, but she managed to walk properly. She's a bit shy but seemed diligent and hardworking. Once the pain was gone, she actively participated in her rehab sessions. She seemed to have a low pain tolerance and was a bit scared. Well, pain is something we all fear, so it's understandable. Dr. Johnson, thank you so much. On the last day of rehab, she stood firmly on her own 2 feet and gave a bow to both me and Matt. Today we had a VIP. Well, her father was also there, expressing his gratitude to the both of us. But it was clear that I was getting more of the credit. He probably heard about me from Amy. "Thanks to you guys, my daughter can walk again. Thank you." Indeed, I knew I could count on the exceptional Dr. Adams and the son of Dr. Johnson. I knew I made the right decision entrusting her to you, Amy's parents said as they departed. But Matt looked as if he'd been struck by lightning. Wait, did he just say, son of Dr. Johnson? Yay, keep that under wraps for me, okay? If it gets out, it's going to be a hassle. The reason why Matt's eyes are wide open. It must be about my parents. Both of my parents are quite renowned surgeons. But I didn't want to just follow the path they laid out for me, so I chose the university by myself. If people knew about my parents, they'd have certain expectations, and I didn't want that, hence the secrecy. But it seems Amy's father somehow found out. If you find out that the person you called incompetent turns out to be the son of renowned doctors, well, it's no wonder you'd be shocked. Please, I beg you, don't tell your parents about me. Matt lowered his head as if he was about to deeply bow to me. In the tight-knit medical community, a bad reputation could be a fatal wound in your career. Seeing Matt so distressed, I assured him, if you've learned anything from this, stop trying to pull rank with your education. You're a skilled doc after all. I told him just like that. In reality, the success of treating Amy had a lot to do with Matt. Matt might have missed the fractured bone on her foot, but he diligently checked everything else. Thanks to that, I was able to accurately pinpoint the fracture. Without Matt, I surely would have taken much longer to identify the root cause. When a diagnosis takes too long and additional tests are needed, it's both costly and mentally taxing for the patient. So, it wasn't that Matt misdiagnosed, and it wasn't solely my success either. I guess, being the shy person she is, Amy found it hard to express her own opinions. That's something Matt should reflect upon and improve. There was a lot I learned from this situation, and I found myself feeling grateful to Amy. And then, unexpectedly, I met Amy again 3 years later. At a matchmaking date, of all places. She was 24 and I was 33. Neither of us was seeing anyone. I'd been thinking it's about time I consider settling down given my age, but I never imagined the woman in the photo would be Amy. She had transformed into a composed, refined, beautiful woman with long black hair. I thought she was someone else with the same name, But when she said, "It's such a coincidence," at the meeting, I was sure it was Amy. "Really? Your leg? Oh, it's already been 3 years." "Yes, I've recovered fully that I can run now, thanks to you too," she said with a slight smile. She's still reserved, but her quiet smile made her incredibly beautiful, and I couldn't help but fall for her. The innocent look she had during rehab was gone, but now she had a mature, seductive beauty that any man would fall for. But apparently, she'd had several unsuccessful matchmakings. "I don't talk much. They say I seem boring," she said with a hint of sadness in her smile. "When I met her 3 years ago, I thought she was quiet and reserved, and that hasn't changed. But men are not great at reading the room. So many probably felt uneasy with her reserved nature." "I like both quiet and lively people," I said. "Huh, you don't need to force yourself to talk. I don't mind a calm atmosphere, and women like you are rare. It's actually a unique experience." I felt embarrassed hearing my own words. But Amy seemed pleased, smiling. "Maybe it'll work out with you." She said that to me. And with that, we began our relationship and eventually got married. We dated for a year, often going to places like movies or art galleries. She was quiet and reserved, but that's not the case anymore. "Hey, you were playing again without doing your homework," Amy's voice echoes once more today. At the same time, I catch a glimpse of our son, Jacob, exclaiming, "Oh no," as he bolts away. Born to us, Jacob has a sharp wit like Amy, yet he's always up to mischief, which is a handful. The once quiet Amy couldn't stay silent anymore, and our daily life became a lot more bustling after he was born. Honestly, it's a level of noise I could never have imagined since the day I met Amy. But I don't mind it. Listen up, Jacob. If you score below D on the next test, even Dad won't play with you anymore. An angry Amy is scary, so I better join in and help her side. Otherwise, I'll be in trouble too later. She's got me whipped now, I'll tell ya. They say moms are tough, and that's absolutely true. But I don't get it. This is impossible to solve." "It's not impossible. I will help you out, so let's get that homework done today." "Really? Yay." Amy just shrugged and watched the conversation with a good grief expression. Even with the struggles of parenting, Amy is a stunning, beautiful mom. I can't help but be smitten by her. Seeing this, our son teased, "Daddy's staring at mommy again. That got next video."